That's a good question. Thank you for your question. There are currently only 4 medications approved by the FDA for the treatment of Alzheimer's disease, but probably what you're referring to is some of the latest information coming out of research about some of the clinical trials. There are dozens of medications in some phase of an FDA trial for Alzheimer's disease specifically, and the latest information that was released is that there's one medication that during some of the testing showed a significant decline in cognitive loss in folks with early stage Alzheimer's or mild dementia. However, that will probably be some time before that's available, and I think a good place to find out more information about research is at our upcoming symposium on October 25th. Dr. Heather Snyder will be there talking about the latest in research and what we can expect over the next months and years with Alzheimer's disease research. So we hope to see you there. Well, safety is a very important issue in the journey of Alzheimer's disease. However, I want to make sure that as a family member, you also think about your dad's quality of life, what makes him happy, and trying to help maintain his independence as much as possible. The good news is there's a lot that you can do to help maintain safety while still maintaining that balance in quality of life. And really keeping your dad active is very important, so that should be one of the goals. I think having an honest discussion with your family can help, and be sure to turn to the Alzheimer's Association. We have many resources, many counselors who can help you through this process, and many products that allow people to wander more safely. We have Comfort Zone, Colorado Life Track, and many different environmental changes you can make to your home to allow your father to live as happily, independently, and safely as possible. That's a great question, and thank you for giving good care to your residents. It's very important, your approach to helping your residents live happy lives. And meal times are a very important time, not just for nutrition, but also for socialization and for helping your residents be as functional as possible. A few things you could look at are the environment. If your environment is chaotic, it's going to be difficult for someone to concentrate. So I would look to see what you can change in your environment. There are also many evidence-based tips out there about what you can do with the actual food. Serving one portion at a time might be helpful. Some things you can do with the color of your food. We're lucky to have a lot of research and one of the foremost experts in Colorado on October 25th to talk about dining with dementia. And they've learned that there are many things you can do to not only increase function, but also just increase the way a person feels, and helping mealtimes be a very pleasant experience. So we hope to see you October 25th at our symposium for Dining with Friends. Well, first of all, you're not alone. There are 72,000 people in Colorado living with Alzheimer's, many of whom have families who are concerned with exactly what you're talking about. Living safely alone can be difficult, but hopefully what you can do as a family is come together and really have the discussion. And because your mom has mild dementia, she can hopefully be a part of that discussion. Early stage or mild dementia is really a time when the person can begin to make more decisions for themselves. The person can tell you what they want. And as long as someone is in the early stages, I would say try to involve them as much as possible. Probably the most important thing is getting your family all together on the same page, having the difficult discussion, and be sure you use your community resources. We do a lot of this work here at the Alzheimer's Association, where we talk to you about planning ahead, what resources you can use. We have someone here who will sit down with you and do a consultation, or you can call our 800 helpline. So you are not alone, and there are families out there who have struggled with exactly what you've struggled with, and use the Alzheimer's Association to help you with that.